cả chuanin kan siat chuan chian chuan in ti ani nge kan en ko lang cái mà hiện lâu về đón ta mi là trong thuốc sẽ lo ho anh chị anh nhìn nhận má cái lâu là cả diagnose mà để cái gì cả quên mỗi em ta tin nắng mà nhìn nu lệ ba tê in pi lệ u tê ho cái gì anh khá thì nghe in care ho u nạp cái cột u ba tê nạp na anh lại anh ta thay hùa liền hết ya mà cần discuss vui khát ông mà nhà tôi Mizoram này ho Mizoram mấy lâu à khát nhiều những cái thay lại chú quan chuan in thiêu thì khi aro quý được tụi mình MZU Discussion Forum này thì luôn thì chua khi aro quý em ho mi ta này tuần tra cái pi lệ cái phu lệ cái nu lệ cái pha lệ cái mà đi con chân ta con ta cái gì đấy thì ho thiêu anh đi khá cái lâu ở về lâu khá apoi mỗi em chuan in tuần na ya ya chú bác cả in xin đi cái ya upa cái này đấyทีมร่างพวกการคลาสที่นั่นส่วนนั้นเชื่อว่าทีมร่างคือสิ่งเดียวซึ่งที่ส่วนที่หน่วยที่กติกาตัวอาจารย์จะทีมร่างพวกการที่กระจับตัวมาเซนิโอ opportunities กันในเราทีนะถ้างั้นท่านชอบก็เราไว้นะให้นี่เป็น end year เทหรือว่าสิ่งที่ตัวเราชัดเลยพวกกันเราคลาสที่มีเป็นรูปแบบโอ้กันเลยโอเคการคลาสพวกยังส่วนนั้นที่เราจะทำแต่ anyway แค่ที่ข้านี่ทีมร่างพวกกันแต่ที่ข้าก็เห็นนะเลนละมาจวนดินกลางโป่งที่เนี่ยจะต่อจวนดินนุลาคานิที่ตั้งตัวตั้งอย่างคนที่สเต็ปไปยันนะคนไทยคานิโอ้ยคิดมันหูน้องเอเลนข้ากับมันเดียวกันเดียโอ้ตาเทียนอันปีที่เล่นทับชีนะอันอินปุยเดอร์อาจจะมาอินตั้งตัวเด็กลางสีปากแค่นั้นฟาดเดียวมาจู่ๆ visit ตัวทีนะนี่ที่ดินกลางอาแค่นั้นชัวร์นะหลายอาแค่นั้นตัวอันโกเลชีอันที่ยังมวยที่เนี่ยจู่ไม่ปากาจวนนี้ไอโซล่าอิสระคันทลากันเนี่ยจู่ส่งส่งหัวจู่อีกข้ากันแล้วลาไปเที่ยวกันดีละเคยโรลKTP อ่ะพอให้คีย์บอร์ดตุ้มสิว่าพอใช้ข้อมาพอคีย์บอร์ดตุ้มให้มีจังหวะที่อันนี้ค่ะปีตั้งตัวข้าอากาศจะแต่งมาอย่างสิค่ะเดียกินะจู่ๆมีปุ๋ยอุปสรรคการมีอันนี้โมที่กันเนี่ยค่ะ it has become quite an in-thing amongst the youngsters also to keep up with it นะค่ะส่วน Alzheimer สันสิเตอิโนเชียดเชียงเนี่ยส่วนเอ็นโคลดานเตตัวดานเตหัวอินเลยพูเตอินนูเลยปาเตหัวให้ caregiving แล้วบางทีก็สวยน่าสักทีนะชุดตาจวนนี้มานี่ค่ะโลนี่เวโดนตานี่ละเอ็นโคลกระตัวนี่ยินกี่ไม่โลนี่เวโดนแต่ละกระตู้เต็มนาทีน่ะมินเลยเอ็นโคลดูดานมินเอ็นโคลเซฟอีกกระดิ่งดานอันนี้ยินกับพี่เด็กกับพูเตหม้อกันชูเตเทียบอย่างนั้นนั่นเองกันเอ็นโคลเตียงที่ยินริลหัวไม่น่าจะพอใจดูดีนะหม้อจวนนี้อย่างคานี้รำผสมนะรำสังกัดนะหม้ออายุบาดเจ็บสาหน้าอย่างนี้เอ็นโคลหน้าอย่างรำสังกัดนี่ที่อันเดียวกันมีพุ่งกันชัดนะค่ะอันรีเฟล็กซ์ชัวนะเด็กยังอยู่ใช่ไหมจวนนี้วันนี้ที่อันนี้ discussion ที่กันเสียงแบบละลายช้างที่export ลุตุกหม้อขยันข้าววันนี้อย่างนี้เนี่ยออกมาจู่วันจวนดาวส์กันมีส่งเรื่องที่มา presentation เนี่ยเดี๋ยวตัดกินกันได้ค่ะมาดาวส์กันมีส่งเรื่องที่ข้าวโซนน้ำมันลุตุกอมโนบินต้องกิน discussion ที่กันดีๆนะเนี่ยเอามาเรียกว่าชูกันที่เรียกสู้มันได้อะอาจารย์สู้ last pass กันมันเนาะไม่รอดอกเตอร์คนอันเชียกันสวยตัว last pass มันยังไงเนี่ย Right? Thank you very much.
Maybe it's what I know, man. That's one can do. Some of professor, so I told me.
Cái form cái gì hậu chọn cái gì cũng chỉ là neurological kan siya, chúng ta chọn những central nervous system kan siya, chúng ta chọn neurons kan siya, pero tại cái giống giống phát hiện cái siam đầu rô quỷ siya, John Chatakin Pakia Nasiama Urutaka in Polero to my Sini, like Hashetsu Apollo Maya, Dolaya Mikan Takin Substance Tiadro, and young that not done joy. Chisang something Katiaman Atikan, money in Tichina, Katiamati, Siate, and delicate look to Kantaksaki in Boynia in Tirsia to Rian. In the Sumatan aku itu kerana mo sumia bang suan boy ni ayah ni kana orang sedon jauh kami longai tahu lah kan waktu itu kasih itu boy ni kalau ni.
Semua akan longai. National Resource Person Dr. Robert L. Khorshim, RC Vice President, State Nodal Officer, District Mental Health Program. So man.
Chairman. Koina dai so te kati ka man talwani asoya ani khan nanam te koi ma tak akal san ba ni ini sudah jalan di Malaysia yang Malaysia itu tong tiang bak lo kita tahu are there any persons who do not understand Mizoram language? Okay, there are a few of them. Okay. It's all right. We have prepared the presentation in English, by the way, so we thought we would be presenting in Mizoram. But now that I heard that we can use bilingual, and we will use both the languages, English as well as Mizoram. But I hope that doesn't take up time. Usually what happens is we say something and then repeat that again in another language. So I'm very happy here to be invited, and I'm also a member of the National Mental Health Program. I don't know whether you've seen the program sheet. It's written District Mental Health Program. We can direct that and make it National Mental Health Program. It's a national program. Under that National Mental Health Program comes the District Mental Health Program, by the way. So it's all the same, but I would like to call it National Mental Health Program because it's a state level. And of course, I'm also proud to be a member of the RC. By the way, I don't know, I don't remember if Madam has told you the full form of RC. Any idea? RC, ARTSI, that is written there in the word part. It's Alzheimer's and Related Diseases Society of India, and we have a Mizoram chapter. Okay, related disorders. I stand corrected. So today we are here to talk about dementia as a whole, and since we know that Alzheimer's is the most common type of dementia, so we'll be concentrating on both. In some cases, I don't know whether how much of study you have done on Alzheimer's or dementia. When they say dementia, they always start it with Alzheimer's because it's the maximum. By the way, any idea what is dementia? Any idea have you come across? Because as Baron said, Alzheimer's and related dementias, this is something which is usually neglected. But if we grow to be old, if we hope to be old, we should know that there is a higher chances of having dementia as we grow older. But there is one thing I would like to tell you. Growing old and dementia are not actually, they go hand in hand together, but not necessarily that a person who is old will definitely have dementia. This is very important for you to understand. Because in Mizo, we have a term called Karma, which means that a person is old, so he's bad. But it's not similar. It's not actually similar. It's something different. There are two different things which I want you to understand. Dementia is a very rare disease which could happen to any one of us at any point in time, because although the percentage of having dementia at a lower age, at a lesser age than 65 is less, Nevertheless, anybody could have it anytime. And the type of dementia also matters. You know, there what happens is that you have loss of memory, but loss of memory could otherwise also happen otherwise. But here we have to remember that dementia is not only loss of memory, it is also a global, or say the whole cognitive, I hope you understand the term cognition, I don't know. The whole cognitive function is lost. Attention may be there, but concentration is not there. Okay, a person is not able to do, is not able to have proper judgment, for example. Is not able to understand whether it is, I mean, orientation to some extent in the early stages is there, but it does not understand whether it's day or night, whether the person has had lunch, dinner. Even after having, for example, breakfast, he may say, "Come on, let's have breakfast again." So those things can happen. But what I'm trying to tell you is, there are many types of dementias. The commonest type being Alzheimer's. In different books, you get different percentages. Don't worry about that. You just know that it's the maximum, that's good enough. 60 to 70% of all dementias are Alzheimer's. Now, what is Alzheimer's and what is the cause? Any idea? Again, because I would like this to be a discussion. We are saying this is a discussion forum. I would have it in a discussion, rather than me telling you in a lecture form of way, or say chalk and talk type. If of course the chairperson agrees. Yeah. Okay. He agrees. He shook his head. I saw it. Yeah. So he says yes. No. So see, the thing is, we are here to try to tell you something about depression and all that. And if you do not understand, if after half an hour of me saying something, if you still don't understand, then I guess us coming here and having that Korean rice is probably not very useful. So it will only be useful if we understand and take back some message. Like first of all, it could happen to any one of us. Secondly, there are many types of Alzheimer's. There is dementia, Alzheimer's being one. In Alzheimer's, the commonest cause, or the cause is unknown. When the cause is unknown, or the cause is we are not able to ascertain what the cause is, after all examinations done, it is Alzheimer's type. Because the second most common type is vascular dementia. In vascular, please, I think, which one was your presentation? Just a moment. Okay. Pathogenesis. Well, go to the pathogenesis first. Then we can come back. You can close this again, or you can minimize it and we open the other one first. Today, we thought it would be worthwhile telling you something different than what you have been reading in books. Something to do with the pathogenesis, something about, we can minimize this. We will come to this later on. We will first go with the other one, the pathogenesis, and then we will come back to this. And this will, in fact, will be presented by my colleague, Dr. Lagi. So, let me, I think we can minimize, can you minimize this? So, the idea is to give you an idea. I mean, not that mobile idea, not that idea, but an idea in your mind that, not this one, pathogenesis. Okay, maybe I'm sorry. Alzheimer's okay, sorry, maybe I'm wrong. This is the one, sorry. This is the correct one. See, I probably have Alzheimer's too. Okay. Have a look at this. This is telling you something about the pathogenesis, from where, what happens. So we'll concentrate on this. We will not concentrate on other types of Alzheimer's, other types of dementia, which the second most common being vascular dementia, as I already said. Vascular means the vessels, when the vessels, that is the major arteries, veins, when they go under atherosclerosis, meaning to say that when they are not so flexible, what happens is that you could have a vascular accident. the arteries in the brain, the small arteries in the brain could actually rupture if the blood pressure is high, or they could not function properly. So what happens is that the area of the brain is spoiled. Most of the areas of the brain, if particularly the base of the brain is spoiled, and then from there it comes up, that would be a vascular dementia. But we will concentrate right now on Alzheimer's type of dementia. Okay. So, well then, yeah, Mizoram quantity. So if you can see this picture, the lower portion, we can see this that it's green. So what does it imply? It implies that the person is right now at that stage of life like you are, where you are most productive. The mind is very productive. Then you go to the next stage where it shows that it started graying. You know, the person is getting old or they having some insult in the brain. And then the next picture shows you that here is just a representation of the fact that now the person's memory has gone, cognition has gone. Okay, so can we go to the next please? Okay, there are many types of Alzheimer's. The stages will be talked about by Dr. Ladi. I'm not going to go into the details of that. And early onset in that, these are some points which I would like you to know and note. APP, for example. Okay, this stands for amyloid precursor protein. Now, this is, you may not remember that it is on chromosome 21, but it's kind of important to know also to understand that chromosome 21 is a very important chromosome. By the way, especially the people in psychology will know that if there is trisomy of the 21st chromosome, then there is something called Down syndrome. Okay, so what happens is that there also, if the 21st chromosome was going, then the memory, the mind was having some problems, isn't it? So the same way here also, it's affecting basically the 21st chromosome, but it could be any chromosome, but here particularly on the 21st chromosome usually affects. And it is this amyloid precursor protein which goes away, which causes the problem. Then of course the other markers or other, say, the genetic mutations occur in these say for example chromosome 14 and other places. But I'm telling you, we don't need to definitely go through very details of this. What is important if you just know that there is some mutation, there is some change. Mutation means change in the cell. Within the cell, there are two parts, isn't it? There could be one part which is the neuron, the nerves, and one part which is the, for example, the outer part of the cell body, not the nerves, within the brain. Next. Of course, this is the late onset. That was the previously we showed the early onset. This is the late onset, apoprotein. Okay, apolipoprotein. Next. Everybody knows the name Alois Alzheimer's, and it was on 8th of April 1906. You know, in 1906, that he found in his patient, one patient he was noticing, and when she died and they opened her brain, then he noticed something. There was a change. So, for example, point number 3, here it says shrinkage. A song, a day, it shrunk. The brain matter was very less. We go to number 2 part, neurofibrillary tangles. This occurs inside the nerves, as I said, and amyloid plaques which occurs outside the nerves. We will see the picture also next. This is just something to tell you that beta amyloid is there, amyloid plaques are formed. We will see the picture. Let's go to the next. Okay, here. I want you to think of and concentrate on this picture. Now, just to understand, for easy understanding, just note that this is the cell, the purple are the cells, that is the nerve cells, and outside the brown part is the cell body. Okay, so cytoplasm you can say. What happens is that in the cytoplasm, cell body, there are amyloid plaques. Amyloid plaques are formed here outside, and it's inside the cell that the tangles are formed. Okay, this if you know this and if you write it in exams, probably Madam will probably give you very good marks. Okay, can we go to the next. So just telling you what is, because we are running short of time, so I'll just be going fast. And you can copy down here the program, in this presentation, so that you can also take it from soft copy and give it to you. So the tangles, how they are formed, it's written. Next please. Okay. On the left hand side, you can see that this was the diagram which Mr. Alzheimer's had first noticed in his patient under the microscope. And this is the representation by an artist what Alzheimer's disease is about. Like, see, you can see the normal, non-disease, and disease. You see the difference? So there is a lot of differences. Many times people say mental health or say psychiatry or psychology is all from hocus pocus. It's not science actually. But I'll tell you, every mental illness, every mental problem has a, what should I say, has an organic base. I'm not saying organic origin, but there is a base. And this disease particularly proves it very much what I'm saying right now. And just have to know, achan ka muthe tak ani antiani. Relu na pa hit na ito may na may ani daw siya ka hit sin ka ta kan pona siya te. So it is nani. Next please. I'm going really fast, I know, but we have another presentation. So if you don't understand or if you want to discuss something, we can discuss something later on. I'm just telling you about the cerebral atrophy. Atrophy basically means the shrinkage or the when the whole brain becomes very small. Yes. Just have a look at this. From this picture, it is very clear and very evident that what normal is and what Alzheimer's is. Okay. These are taken from brains of dead people. There are skeletal sections. You can also see that from outside, the brain matter is usually the whole brain itself is small. In general. Okay, next please. Here also it just showing you one, because say even the spaces in between, you can see the spaces in between the gyruses. Well, the sulcus and gyruses, these are very much increased. Next please. One thing very important here is this chemical called acetylcholine. Okay. This will be talked about by Dr. Ravi, so I won't be going much into details, but I just want to tell you one point which I have made bold. The hippocampus is the area of the brain which is recognized for having memory. So, and this is the part which is affected most. They have many names for it. Some people call it from the base of the brain, they call it the nucleus basis of Maynard, and some from the outside it's called the hippocampus. Whatever name it is called, it's from the base of the brain and it affects the memory first, especially the anterior brain memory. Okay, next please. There's a picture of showing you where the hippocampus is. I think you already know that. Next please. And this is showing you a balance between a normal person and here is written Ronald Reagan. I mean, because Ronald Reagan, the president of, ex-president of the United States of America, also had this dreaded disease. So we're showing you the balance. In here, you can see the acetylcholine is very much reduced and the dopamine is high. Whereas in a normal person, it should be balanced. So it is imbalanced in a person having Alzheimer's. Next please. There is genetic susceptibility and environmental causes. There is no end to the debate. I will not start the debate right now. I think that's the last. It can be. You can see the next case. That is the last. But before you clap, I think we can invite Dr. Lali to continue with the next portion of the presentation. Come on.
Good evening, everyone. I'll continue with the symptomatology and stages of Alzheimer's disease. Now we know that the brain is a remarkable organ. There are several complex chemical and electrical processes that takes place within the brain that let us speak, move, see, remember, feel emotions, and make decisions. I want to highlight on the functions of corresponding with the different lobes of the brain. Just have a look at this picture. Now our subject is Alzheimer's disease. We will be focusing mainly on the temporal lobe, but as the disease is a progressive neurodegenerative disorder, the pathology or whatever lesions may be found in this disease, it will progress. But the progression may vary from person to person. Here we can see that in the temporal lobe, having to do with memory, emotion, hearing, and language. Here we have the parietal lobe, which is concerned with the reception and processing of sensory information from the body, and frontal lobe, mainly with decision making, problem solving, and planning. Hello, a function so how close are you? Let's have to kami Alzheimer's disease na. Anyone develop na umabangkan brain na a function pa nga ito alo so yang ka alo ti boy do na bangkan a function ka symptoms ka alo lang chanju ka a function ka ti boy bangani. So common symptoms commonly and memory loss. Common le aron mo sa person ni ang tani ni aron mo sa person ti ko kinahanglan so nga tin kinahanglan na forgetting words or substituting inappropriate words. There are problems in speaking, reading, writing, and understanding. Disorientation, the time and place. There are poor or decreased judgment. Problems with abstract thinking, misplacing things in inappropriate places, drastic changes in personality, difficulty performing familiar tasks or routine course. 10 warning signs. Say, memory loss that disrupts daily life, challenges in planning or solving problems, difficulty completing familiar tasks at home and or at leisure, confusion with time or place, trouble understanding visual images and spatial relationships, new problems with words in speaking or writing, misplacing things and losing the ability to retrace steps, decreased or poor judgment, withdrawal from work or social activities, changes in mood and personality. Can only currently kilang sa kaya nilawa. Atlang point early onset to Taiwan or to common start from old age how to the kami bangkan hey game ani ko daw sin chaila ngani enti ko nang professional ni kan pardon Alzheimer's disease ilaw there and kay kan pile ute kada kan kim awarding signs tadi ang poy mo em. As talked earlier, Dr. Alois Alzheimer, he did a histopathology study on the brain of the deceased Miss August. So these are the two types of lesions which are characteristic and distinct to the cerebral disease called Alzheimer's disease. These are senile plaques and neurofibrillary tangles. Formation of senile plaque. Kaya kasi akan lo sa ito hindi ay inform that he can end up to have the right left upper lang atang yan clockwise yung nagkalani. Kira yan, we have FPP on the surface of the neuron, and the second picture shows it is sectioned by enzymes to release the amyloid beta. And then under normal circumstances, the amyloid beta is cleared in the body. In Alzheimer's disease, the amyloid beta is not regulated, so it is found in greater quantity. So these proteins, they assemble to form these senile plaques. This is a formation of the senile plaque. And how does it spread? Initially, it is observed in the cortex. And secondly, in the hippocampus, and reach the whole brain following a centripetal movement. And the progression does not correspond to the symptoms of the disease. Kalau the senile plaque informed initially observed in the cortex. Cortex to again cerebral cortex more brain function inform and secondly in hippocampus the hippocampus to memory memory problem of to formation the spread and then the neurofibrillary tangles. As we know that the interneuronal transmission occurs through the soma of the neuron to the synapse. And the signal passes through the skeleton of the neuron, which are composed of microtubules. These microtubules, they are stabilized by a protein called tau proteins. But again, in Alzheimer's disease, tau protein is defective. So, as we can see from the pictures, the tau proteins, they stabilize the microtubules. So if the tau proteins are defective, there is dissociation of the neuronal skeleton. So these defective tau proteins, they again assemble to form the filaments called the neurofibrillary tangles. Without the skeleton, the neuron degenerate and connections between neurons are lost. So it ultimately leads to the death of the neuron. How does the neurofibrillary tangle spread? First, here, it also develops in the hippocampus, which is essential to memory and learning. And then it reaches the whole brain following a centrifugal movement. Progression of the lesion corresponds to the symptoms of the disease, which begin with first, memory problem, followed by problems of language, recognition, incapacity to perform gestures, and ultimately global dysfunction. Now we will talk about the stages. It progressively develops over years, but it varies dramatically from person to person, as we've already said. It may be from 4 years, 8 years, or as high as 20 years in some cases. And since the progression is usually gradual, there can be no clear-cut or well-defined stages. So stages can overlap. A stage, a definition in terms of Alzheimer's is progressive, neurodegenerative, kami bangan a progress ni ni. Amai a progress dangkai anglawatin amuang dem boga. Ani to stage haton oma to stage haton tika asoi thelo. To bangton asang stage ni zilna kana stage an define kita. Hepa hello ti chat thela ni chong lawa. Sang stage tika in overlap trina. Tuan clear-cut or well-defined stage or effects of aging and memory, but not aging to a stage confusing forgetting things occasionally, misplacing items sometimes, minor short-term memory loss, but no effect on ability to function. Judgment and decision making intact normal physiological aging according to some research, hippocampus a string, a song to the normal aging process. Kami bangka ni ini dia buku pada high hot there, kaya ha otu, kaka normal. Ani, masih no effect on ability to function, judgment, decision making impact again. So the stages of Alzheimer's disease. We have the mild, moderate, and severe. The mild stage usually lasts for 2 to 4 years, marked by minor memory loss as well as difficulty learning and remembering new information. Long-term memory and some reasoning remain intact in the appointment. Patients may be aware of their decline and highly well. The professional diagnosis population kung panga 50% ito ang symptoms and experience nito baka diagnosis Alzheimer moderate stage 2 it lasts for 2 to 10 years. Patient experiences withdrawal, confusion, increasing difficulty in self-care and daily tasks, poor judgment and difficulty communicating. Need in anti-torang judgment kami ka at solo bangkan kan puitun mamoto ni behavioral changes often include anger, anxiety, frustration and restlessness. Caregiver assistance becomes increasingly necessary. In the severe stage usually lasts for 1 to 2 years. Patients are completely incapacitated to retrieve themselves and do not eat unless fed. Patients may not speak and do not recognize people, even family members. Loss of bodily function control, example like swallowing, bladder and bowel. Violent episodes and aggression are common. Moderate stage and medium high rate moderate and high rate unsuitable, unfaltable, and meet the soil and recall unfamiliar and how much and recall severe and shallow story. So I a stage as you had mild, moderate, severe, memory, language, visual, spatial skills there, as well as function there, activities of daily living, effect maybe a stage there, construction.
For your energy presentation. So now we move on to interaction session. So the third part.
The zona unsuan itu zona siapa siapa all questions are welcome. Apparently, when I was doing my MD, elderly was my my thesis. I did my thesis on elderly, and the second most common people, I mean, in terms of the total prevalence incidence was this Alzheimer's. So there's a little bit of research on that. So you can ask questions. Feel free to ask questions. If you don't ask, then it's a discussion forum, so we can start discussing on such points. But I would rather if you ask questions, or if you just want to discuss something, it's most welcome. I think the chairperson agrees to all that. And I know you're probably feeling hungry now. Professor Baby has gone up to see whether the voting rights is done or not. So feel free to ask. Again, so to tell them, so I tell them. I think again, till her eventually again, woman look low the way. In the course of the last, after coming, yes, so the name.
Learning also the way. I'm more confident in the saying the book. I mean, Alzheimer here, hello, what you think and states I think states of the clothing and data different from childhood infancy, adult savings at least, adult development, and states of the king super so to up and states of the so to up measurement and frequency of tasks and so on. And memory to Alzheimer memory loss memory ka 100% ita se exact person jin loss kanin nge long ta se person ka measure long ta se asa long de na ka ini long ta se ujo lo on ni chonin exact person loss in Alzheimer
As or not, can be a child with all the child, you can even. Okay. Then I can't never. And it's one day to the focus. The stage here, and the game akan, the draw, and the game Alzheimer stage akan, so not attack any of the sensor and check the chip on can say, who but to a young thumb can get it. Akan, the two young adults have akan take on it. Massacre is very rare. So Atlam within 65 years and above ahead. Any as more Atlam within age of retirement he goes from Ani Vankan, India and Rama is one goes from and above his elderly at the time. Mizoram is one goes from and above the MOP and the elderly so the man so goes from Nasa Sarai and Kanya is one. Masse consider also America is one. Uncle down to 65 ahead of that unresearched area here at 65 to 75 young old and they are 75 to 85 the old and they are 85 and above the oldest old or oldest of old and the tani kumka atak hole a chance ka asal ba dila kan so ni mo sa research ka mulu to lawa he feel yan siang kanin asoy he lawa he kan he takaraw dalma ko kan mo he kan download America here research atam dera chu bangsa ani chu siang kanin he chuan 5.2 billion Americans of all ages have Alzheimer's diseases in 2013 again 2013 akan 5.2 and direct so billion so Indian research kaman in China India kan 3.7 are population ka atam dai so sia India in tam masa ka din dai it's one is 100 thoni the asa chu research tak kan nei lawa India is one kan and tak lo ba kan 3.7 chu anmu siang takan mu ka ani ne ba ani population America is 3.45 million 350 million Veganita katakan 5 million ka Alzheimer's anetane ini actually we are 1.2 billion katakan only 3.7 million dementia kan coba ka dementia kan Alzheimer's ko kada dilo so actually yang tikun ako akan dia masih lampuin usul yang pengaruh yang atam dia kasi lo kan sang champion ni ada soal second part kan measurement kita kita head aja LOE in lain apa kalau NMSE kan kita mini mental state examination ini dia head apa ini test jasa kami ada maya I think tak ada jadi apa ini kerana di drill check dah ni tak jasa kami tadi Kita share that IQ ni maya masih macam IQ kan check ini adalah mini mental state examination check dah katakan kau kena share kita ni katakan score ni untuk 25 and above score ni total 30 ni kita scholarship only. So I'm asking about that. And it's not a scholarship. Above 25 to 28, so unscored one. Okay, again, but my problem to zero kan ya. Oh, no problem. Masa ni akan cuan problem kan sah. Dan yang 25 above macam ni, tak borderline detention between 18 to 24 ka borderline detention ta. Masa macam tu dah sampai soalnya kalau ngah, kan ada minggu ni, kalau di tahun ni kalau from tu dia kan, can you correct me if I'm wrong? Please correct me if I'm wrong, no problem. Asal tu, ini macam ni macam nak saya kalau ni. Anyway, so I hope that answers your question. There are many scales. There are a lot of scales to measure it. And it is measurable. So my papa, diagnosis as a doctor, as a physician, as a psychiatrist, diagnosis ka counts one, not only a clinical picture, so as one neuropsychiatry karne ka pa kan clinical psychologist ko check nga kasi nakasaya kan. This one imaging shang करने का CT scan करने था तो ना MRI को करने चेक तो आप Mizoram को या so SPECT या SPCT single photon emission tomography something को kan kona share data ni so PET positron emission tomography kan ko kana share so share data shang करने ni so akan kailangan so ni Alzheimer ni kan di may dong kan pinpoint ito kasi sa yang kan tunay pilati doktor lagi harus yang kan siap stage itu kan cuma mereka pas overlapping ketemu juga so you can just say that there are 3 stages masa ini kalau if you go to internet some will say 7 stage there only some will say 5 stage there but don't be confused just know that ICD-10-1 it gives only 3 stage that is mild, moderate and severe. I hope that answers your question. Any other question? Any other point of discussion? While you're teaching? Ipapan ka so kayo. Pati pa na yung group ko ano. Okay, yes, ma'am. Okay, there's a question says, is it hereditary? I say that's a very good question because it's a trick question. I can say yes and no, and it will go the wrong, or it may go the right also. When you find genetic markers, when you find that yes, in a certain way, yes, certain studies have shown that yes, it is to a certain extent hereditary to एक होते ना चलो और मासे है क्या चु खान दो मुखान अलग खान apa yang akan pengen kalau kita cuma strong loh but yes some genetic linkages have been seen and yes some may be hereditary. Yes sir. Yes ma'am, the man has something to say.
Dementia kan, Mizoram art na kami kami ada kan saya kasuan. Anti law kan dikenya doktor no pamina art na art na Mizoram art na ko. And done on only one. So while I speak, you cannot be done. So you can turn on your.
No, but he answered everything, so I think that answers your question. Is what I challenge you.
Okay.
Oh.
Had ya so I didn't tani dia la khan chuan mo up still Alice okay the movie still Alice that is a typical familial Alzheimer's disease more kaka if it happens in the family is also for counseling and fasting kaya kati ama no anti chikani na mo what still Alice hani asian so it's baka country if something like that happens in the family, then can you drink more otherwise family India identify case to me so to result percentage am I wrong to the genetic position more in my because genes are
okay, I purposely left out that part more, hereditary versus environmental harm. I thought that would be a good part to discuss.
Yeah.
Tu nak kan Pak kan Profesor Rizal Soya hereditary coba confirm. Masih tu lepas dengan kan apa pun dia pun dengan kan itu that depends entirely on the environment. And of course, the genetic, how strong the genetic, whether it is very strong influence or not. So yes.
Actually, what I want to ask is, it is about the Alzheimer. We already talked about the disease about the Alzheimer, but it is an awareness. So what I want to ask is, suppose if someone is suffering in my family, so what are the preventive measures that we can take to this disease?
Very good question. I thought you would ask. So good. Preventive measures. How can you prevent Alzheimer's disease? First of all, it is not very clear that Alzheimer's disease is going to happen to any of us in this room. Nevertheless, it could also happen to at least 50% of us. We don't know. So what people say and suggest is, just like any other disease. Now, like here, it says Alzheimer's and other dementias. There are many other types of dementias. Alzheimer's is one thing that, unfortunately, they say cannot be prevented. If it is to happen, it will happen. It may happen early or late, depending upon your lifestyle. But if it is to happen, it will happen. But there are the other types of dementias caused by other diseases. That can also be prevented. I'll come to that. I'll come to Alzheimer's too. I know what you're trying to say. But I'll give another chance to speak. Hear me out first. See, like for example, I was talking about the second most common type of dementias, which is the vascular dementia. Now, if you control your blood pressure properly, how do you control that? Simple. See, normal physical hygiene. Get up early in the morning, go for a walk, eat less salt, eat less of unsaturated fatty acid. I mean, eat good oil, for example. Sleep early. All these, everything that we say about normal health applies here in dementias too. If you do that, if you exercise regularly, maintain your cardiac functions properly, then probably your vascular dementia, chances of having vascular dementia is reduced. But there are other diseases, for example, Creutzfeldt-Jacobs, that is because of some virus. Now, it means that your immunity has to be strong. Immunity has to be strong that even if you're, say you go to Africa and you contact this virus, if your immunity is strong enough, then it will battle and then you will have disease. But if your immunity is not that strong, if you are HIV positive, just for example, if you are, say, are having other tuberculosis of severe type, biliary type, or any other disease which compromises your immunity, then you have a chance of having virus or viral infections, which also causes other types of dementia. Now coming back to Alzheimer's, they say you can delay to certain extent, and that is also not actually proven, but this is the hypothesis that probably if you eat good oil, if you, like what you just said, all the things that apply to normal good health, if you do that, then obviously you'll probably be able to delay. But as I said, unfortunately, this is not something that we can stop. It is not curable. Hear me out. It is not curable. I'm saying it again and again. Now, Madam also said, the professor said that there was a magazine, Time magazine, which said that it's probably there's a pill for it. Yes, we do have medicines. Those medicines, what do? They do not totally arrest, but they do help in other parts of the. For example, what we're trying to basically do is we saw that there are neuropituitary tangles. We saw that there was some tau proteins affecting all that. We saw amyloid being deposited. Now what can we do? We're trying to make the process slow. We're trying to increase the blood flow in the brain so that what happens is that it can be washed out. So that immunity, we're trying to actually basically in very simple terms, we're trying to make the brain healthier. Okay, all the medicines that we are using, for example, we are using donazepam, for example, or we are using other things which increase, for example, the acetylcholine, that neurotransmitter which we talked about. We're trying to do some things which will arrest it. Of course, unfortunately, we do not have drugs which totally arrest it. But we are hoping that there will be something that not only arrests the problem, but also reverses it. So far, we haven't been able to do it. Now, recently when I went to this RC, representing the Mizoram chapter in Mumbai, they said since the genetic markers have clearly been shown, a person who is having that, now they will be able to detect who is having those markers, so that whether, for example, if I have, if you change my blood, if I have those genes, which means that I have a higher chance of having Alzheimer's, then what I can do is, right from the beginning, I can probably take some medicines to either arrest, or to stop, or do something prolong at least. So that is the future at it. And maybe in a few years from now, they will find drugs or maybe even a vaccine which stops all this. But as of now, yes, it is not curable. We have to accept that. And it is, like our doctor said, it is a progressive. You cannot even stop it. It's very unfortunate. That's why today's awareness will be to actually feel for the people and the relatives of those. Because it is not something which can be done back. This last year, the theme was remember me. Yes. And the thing is, there was I posted it this morning, last night or this morning in our group. In that, there was one old man who wanted to have breakfast with his wife who was having Alzheimer's. So they were asking him, why do you want to go? She doesn't remember you. She doesn't remember you. Why do you have to go to a person all the time? He says, they may not remember me, she may not remember me, but I remember. This is the message which we take home. They may not know who's helping us, but we know. We, the healthy people, we know, so it's our duty to see that they are taken care of. Okay. So any other thing, or should we stop? Yes, sir. Okay. Go on, Mr. Yes, ma'am, would you like to answer? So basically, zona ka early symptoms again ya. Attention so cuma amoy ha ada moy kan ya dia kan kita amoy cara soi pok kan ai kon da ka tu early symptoms ada dia di chuan di ne mai makse dia tu maksudnya hati ra chuan kia ka har lu ka san chu elderly ya depression ni tak sia depression ni ya dementia akan don ni ai ko pa mai ni amnestic disorder dia pun le ka kan share ko ka ba psychology background ni ka chuan share ma amnestic disorder kan share ICD ya ko kan oma kham dia kha ani thei na sia so wang chuan kha chia ka kan ani dementia chu ani thei ni so na chuan ani thei re ma se dementia ani nge no ni chu asoi ti lo kan so wang chuan kha dia ka chuan so ya sai no test kan ne ya kha kita ni clinical psychologist kan kita andi wana no check kan ano en nasa MMC MSc le sang sang ka ke ha coming back
we now coordinated the Western memory scale
indication content that's all about yeah content ka ati ka ni le square kan CT te po kan en kiran tu lai wei ni ya tin problem up an hem ka ti sa wei ni ya kan CT kan dia kan da cha cha na wei na kan wei nu akan ke kan 5 months 6 months ko ka ti no dia ka progress na ka kan to kan complete ta na amal an to ka ya asya ti to kan ma se ka square kan ni ya ko ni la That's not a good problem. See, the work to good caretaking. Way more than me. Okay. Labo. Sila tu na hen kan soya be no tham khom mai Alzheimer treatment for no kio ka treatment so ma kio po chia lo ka dia. Chuan sila sang ni okta ni chu ke ai chuan ni psychologist clinical psychologist kan an soi thia ma se tu makan kala an soya an min shila kan thit tahi di rabu an ti du ro kon ti ta tahi tha ma se an ti du zong kha a thaya ya ni an for example music an du zong te a ti na ni chuan khang ti khang khan music therapy ya ni an ni chuan action songs kan mai hoi mo ta action songs ang chi kha ti dir nge he ro ta sa che kha ni physical activity nei na chang te tha to lo mai thei so ma chuan physical activity ta nei pui dan kha ni se ti ra an ma ni la du ang chi khan action song ti ran ku da chuan nin la ti ta ka my body lies over the ocean khan le ya chuan Atia kan direkta my body kita hari kan dia kan dia movement ship kan an body exercise kan buat dia sih kan exercise kan ada di dalam itu kan dia kan dia kan dia terus dia itu kan ada transfer di rumah nuaman dia sih kan di wui kan cari an hobi sih kan gardening kan buat tuan pino masih di wui je pulang Ano nila tujuan dia mo. Hindi mo yung kaya sa ano yung pwede pa to kapata. Ya po ito na rin. You do it then ka na ako. Kapata eh. Tam tagaw mo ito ng system ng mga pastor ka. O nakita. Yes. Last. Yes.
Question 아니 도로에 대해서 나오면서 제가 그래서 안쪽에 넣어놓은 정상화 있는 안쪽에 넣어 위에서 좋은 정상화 그래서 existing 같은 거 마세가 저는 그래서 이 education가 나와 있는 types of personality classification 하는 introvert introvert extrovert introvert 같은 게 빅그룹 선생님이 about explaining Alzheimer 아니 가 사이언티스트에 비해서 퍼펙트 맞추는 아이로 기억도 그러니까 사이언티스트 맞추는 게 그러니까 아까 있었던 엑스페이의 알젠티도 아니 뭐가 또 뭔가 신경 내면 또 앞에 볼때 엄지 투어로 바꾸면 저는 인트로버트 주제 말 아웃룩 앤 지금 I'm doing frequency, but then I go, so I'm going to move to the person. Memory can go start and more archive. Second, it's going in. Certain introvert persons are more likely to have Alzheimer's disease. But the introvert will have some Alzheimer's disease.
Kami katu kain to sina chuanin personality factors introverted ani mo extroverted ani mo psychoticism asama mo neuroticism asama mo personality factors akasi ka conscientious deute agreeableness asama aktive ka but late pa ka o study right so ani he pilaya yam kami ka ko no la mate ko study ta ila lo kami ke study ke education department because you also deal with personality factors we have a whole lot of personality measures and then you can go to the again in terms of research actually you can go to the Alzheimer's population and give kanya kani maseni metros anmani ka associate say lo si lo ta to pa to the give na te lo chan sam tu ho kanya ka rating scales they want in terms of related to what you asked, like what can be done in order to keep at bay whatever you might suffer end stage end stage in the sense that but more Tulaya la and what is very very popularly endorsed is exercise. Exercises healthy Dr. Robert healthy lifestyle. Time magazine, if you look at the Time magazine in February, the February issue, right, it should be available in the market also. The entire, the whole, again, the focus is on Alzheimer's and the current status of Alzheimer's disease. You will see that exercise is the main thing that is like. And on top of that, music, songs that you had learned when you were younger, try to continue to remember. It is more important than the new songs. Instead of old memories, make a connection always. So do not forget the old songs that you used to remember. Alright? Keep on singing. And if you have forgotten, like you can go back to the lyrics and relearn. Alright? Make the connection always. Music therapy. And on top of that, in terms of alright?
Sir, whether you have asked or not, I don't know. It is a very simple question, but it's very common. I have experienced like nowadays, even in younger generations, it's difficult for remembering some persons and forgetting easy things. And we cannot focus on classrooms. These are very common things happening. So, as you said, that there are a lot of different types of dementias. Can it be related to dementia or something like that? I don't know.
Okay. Maybe this is the last. Okay, good question. First of all, yes, forgetfulness is there. We do forget things. But let's not associate every forgetfulness to Alzheimer's or to dementias. That should be the last thing on your mind, because I hope, touch wood, nobody has Alzheimer's. It's a very dreaded disease. And yes, I would like to say forgetfulness, although it's quite a lot, it won't be, like Adam said, the youngest person who was found to have Alzheimer's was 40. So, before that, it's probably just forgetfulness. So we are telling about exercise. not just physical, you also have to do cognitive exercises as Madam always told you. Remember, try to remember lyrics. Try to remember. See, what we usually say, what we are trying to say is that even this technology is actually reducing our cognitive abilities. How? You may ask me how and why. I think I've explained once before. This mobile, for example, mobile is actually reducing our abilities to remember numbers. In our days, when I was your age, we didn't have mobiles. So if I had to call somebody, I have to remember if I had to call Delhi, it's 011, I have to remember that. I have to remember the STD code number, I have to remember the phone numbers. If I have to call a certain someone who's special one, then I have to remember that number. Now, I just have to dial in the name and the number comes automatically. What I'm trying to say is that we are using our mind less and less by having these gadgets. So try to remember telephone numbers, try to remember addresses, pin codes, for example. Long time back, in our time, there was no email. It was snail mail then. We used to write, we used to apply it, have sent it. And then when the person gets it, nice when it used to come. We used to do that. We had to remember pin codes. Now you don't have to remember anything. And even email addresses you don't have to remember. Just dial one, the first letter or two letters, and then the whole thing comes up. And then that's why now I'm trying to tell you that use your brain. Try to purposely remember numbers. Try to purposely remember email addresses. Okay, and then that's why I purposely try to remember our anniversary also. Anniversary. I beg pardon. Absolutely, meditation is absolutely useful. Meditation is absolutely useful. So, time is given back to the chairperson.
Miss Marina Legitahi, Department of Consomamo, Discussion Forum MZU, meeting from Ida and Loruto. Join the Central Secretary.
We would like to give a big thank you to the team, our resource person, Dr. Robert. I know him personally since he and my mom works in the same office. I know he's a nice guy, and the information that he has given was very, very informative. And honestly speaking, I understood about 30% of everything that he said because it's not my name. And okay, name-wise, okay. Thank you, Dr. Robert, for the very wide understanding of how the brain works and how Alzheimer's disease can just simply destroy a family. But thanks to our to Ms. Ishkila Dubri for telling us that an Alzheimer's disease is understandable. It's not preventable. We don't even know whether it's hereditary or not. So it's kind of human beings, we adapt, right? So it's important for us to adapt to a family of all types, to a person with disabilities or a person with Alzheimer's disease or something like that. So I think the thing we have to learn from today's seminar is that we have to be adjustable. We have to live a healthy life ourselves. We have to manage our bodies ourselves. So I would also like to give a big thank you to Dr. Nazim Khari, she medical officer, for giving the second part of the seminar. I don't exactly know how to say a bigger thank you than this. So I would like for for youth department. And our dean of social sciences for guiding us at the beginning of the program. I know she's a busy lady, so probably I want to thank her personally, but she's not here, for giving us the time, her precious time for this program. And our dignitaries, the person sitting in front of the hall, thank you for attending this program. I know you guys are all busy and you're all busy in our own world. So thank you for attending this program, and thank you to the media for covering this entire program seminar. And thank you to the psychology students, because I know this program would be nothing without you guys. And this program would definitely be such a bummer if you guys weren't here. And I hope this program helped you a lot. And for the political science and other departments, students, our seniors especially, you've been here supporting us since the beginning. And the executive committee members of the discussion forum, thank you for attending this program. I know it's kind of late now, so I'm going to wind it up. And thank you to one and all for attending this program. And I don't know whether when we're going to have another program, the discussion forum. So I'm going to invite you in advance for our next program as well. Thank you so much.
Discussion forum here. 28 April, Thursday. Yang program ini turun dia, so parliamentary democracy and its practices dia. So itu in PUTP, Mizoram Legislative Assembly Speaker, and itu so when I look at so they have to effect on dia, and no